City Manager. I'm just going to go through who we've got here on the call or on our GoToMeeting before we get started with our agenda. We have our health board members, myself, Mayor Nathan Johnson, and Dr. Mary Milroy. We have ex officios, Dave Mingo, who is our Community Development Director, Brad Beast, who's our Community Development Manager, Commander Jason Foote with the Yankton Police Department, as well as our City Attorney Ross Denherter. We have some guests with us today, which we're fortunate to have and excited to hear from. Dr. David Basil, and please correct me, Doctor, if I'm mispronouncing your name.
That's exactly right.
Welcome. And I believe Doug Ekren is also going to be joining us with Avera Sacred Heart Hospital. Doug, is that you? I see as caller one.
Yes, I'm on, Amy. Thanks.
Okay, welcome. Our agenda today is short but probably heavy. I don't expect we'll get through all of it today, but we want to make sure we have time for our guests. So I'd like to start off just by having Dr. Basil talk with us a little bit about the COVID-19.
I lost her. Did anybody else lose her?
Yeah, this is Doug. I lost her as well.
Yeah,
Okay.
we all did.
So I think I'll go ahead and
Here.
Please do.
And I think the main thing that they asked me to talk about today is modeling and trying to project how many beds, when, and what kind of a surge we think we might have. Was that the main topic that folks were interested in from me today?
Correct.
That's correct.
So I'm Dave Basil. I am a med peds physician, and I've been kind of the lead on testing and also putting together the data scientists that are doing the modeling for Avera and following that around from a systems standpoint. And so from the modeling standpoint, my main role is to put some really smart people into a room to do some modeling with that and make sure that it's got a practical bent to it and kind of interpret it from there. And so with that being said, it looks like I have to ask permission to share screen because I can show us a little bit of graph here as I go. I'm not sure who the organizer is. Can somebody allow me to share? Or did we totally lose it?
Yes. I'll have Dwayne Johnson's our organizer to share the screen here.
Okay. Oh, while he's doing that, I'll go ahead and kind of get started talking about it a little bit. So what this is, and the slides I'm going to show you are just a couple of graphs, and these were put together. There was a coalition between, oh, excellent. Hold on one second here. It looks like people should be able to see my slides now. Okay, so this started out, we did 2 rounds of modeling. Both times it was data scientists from Stanford, Monument, Avera, and the state of South Dakota that came together to do the modeling. And so we all used slightly different modeling approaches and came up with pretty similar numbers both times. So the first time we did this was back in March, and kind of the assumption then was based off of data mainly out of China because there wasn't too much coming from the coasts yet in the US. And we didn't put much assumptions into it for stay at home, shelter in place, any type of social distancing type of stuff. And those first round of numbers, which I don't know whether you saw any of those at the state level, were pretty scary. They had about 5,500 bed total for the entire state of South Dakota at that time, which was would put Sioux Falls at about 2,000 beds, and so that would put Avera Sioux Falls about 1,000 beds, so over twice of what our usual operating capacity was. And so those numbers were pretty darn scary the first time we looked at them. We then took another approach, which ended about a week ago, where we used more data coming in from US numbers, as well as looking at what our actual hospitalizations had been trending in the South Dakota region. And we use South Dakota mainly because we've got the most full amount of data in South Dakota, and kind of projected it based off of actual numbers, and those revised it down, cut it almost in half probably. And so that's the numbers that I'm going to show you today. And so these are a group consensus between Sanford Monument, the state of South Dakota, and ours. The main model that we've kind of all agreed upon, if you follow, I don't know how geeky you guys want to get me here, I'll stay somewhat high level. I can get into the numbers more if you want, if any of you have played around with the modeling at all, but they're based off of a CHIME model or SIRS model out of the University of Pennsylvania, which you've probably seen that one. Based off the population of South Dakota, the Sioux Falls portion of this is just based off of Avera Sioux Falls market share, percent case hospitalization, percent admitted to the ICUs. Those are all based off of national figures, as well as the percent ventilated and the length of stay, how long you stay. And a lot of this is predicated on the fact that there's something different about this illness than influenza, mainly being the length of time that patients stay in the hospital once they get hospitalized. That's the big problem with this illness, is that once you get it, if you're going to get it bad, you are sick forever, and it takes a long time to get you off the vent or get you off of oxygen, get you back home again. And that's one of the reasons why these numbers tend to stack up so much, is that the hospitalizations last a long time, and so people start stacking up in the hospitals over time as they get added in. And so that's why these numbers kind of tend to get out of hand, is because it just takes so long to get on top of this. And this is the big slide that's probably going to be the most interest to folks. This is the yellow line is the number of average census, so total number of heads and beds on a given day across the state of South Dakota. The green line is the number of heads and beds for Avera Sioux Falls. And so what essentially McKinnon's volumes. This is only COVID-related hospitalizations. So this is not your usual med surge, car accidents, heart attacks, strokes, everything like that. This is just hospitalizations related to COVID. And so you can see, and this is kind of where we've been tracking, because these numbers were updated and adjusted for our actual hospitalization numbers. And I can tell you, over the last week and a half since this projection went out, Sioux Falls, we've been tracking these numbers pretty much exactly with what the projections are showing. We've been doubling about every week on our hospitalization so far. And you'll see that Sioux Falls has a lot earlier peak than the rest of the state because of our higher population density, and also because we've got the Morel plant that's kind of driving us to rise quicker than the rest of the state. And so that's why you see Sioux Falls, we're anticipating, is going to peak mid-May. The rest of the state is going to take a little bit longer for this to spread, and we're showing that peak to be the end of May into that first week of June. These are our numbers that we projected. The state's numbers were a little bit higher, so you might see a 2,500 number being quoted by the state sometimes, because they had used a little bit higher admission number than we used, which put us a little bit lower, at closer down to 2,000 instead of 2,500 number that they had. And they also were about a week or so later. They were around the June 7th, 10th is where they were predicting this surge as being, but close enough with the modeling that we weren't going to argue one way or another. So we were fine with supporting those. And so I talked about this number used to be about 5,000 for the state, and it's now down around 2,000 to 2,500 for the state number. So it's really dropped in half. And the messaging that we used with the state is that, this is showing the effect of the social distancing that's already been done in all of our communities and across the state. We've seen that effect. It's been successful in slowing the spread of this from the rate of increase we saw early on to when all those stay-at-home orders went down. The number of positives really slowed down outside of a couple hot spots, and that's what's kind of running this number later rather than earlier. And I'll show you a couple slides here in a second on the effect that some of those measures can have and how we model some of the effects some of those measures will have. One thing with this is probably later this week, maybe even midweek, we're hoping to get some more Sacred Heart specific catchment area numbers. But I can tell you, just looking at the population from the 7-county kind of draw area that Sacred Heart pulls from, that's about 75,000 people in those 7 counties. So that would be roughly a little under 10% of the overall population of South Dakota. So it'd be about 8 or 9%, somewhere around that area. So if we just did a pure extrapolation off of those numbers, off of this, 2,000 plus number, that would be looking at around somewhere between 150 to 200 bed census peak at Sacred Heart if those numbers hold true, peaking about the 1st of June. And so that's still well above the stated licensed beds at Sacred Heart, and certainly a lot higher than the average census at Sacred Heart. And so that's why those numbers are still pretty eye-catching. In Sioux Falls, it looks a little bit better because we've got about 150 non-COVID patients at McKinnon usually. So this pushes this up to more like 500 beds. But at 500 beds, we usually go on diversion at 400. So it's not that much higher than our normal. And with us opening up the Prairie Center with another 100 beds, we can get a lot closer to not being overrun. They look a little bit scarier, quite frankly, for Sacred Heart if those numbers stay true. It's going to tell us part of the problem here too, is we're sitting here about here, we've got another couple of weeks here where we're just going to have slow increases, and we're not really going to know, is this really going to take off until about the first, the second weeks of May is when we're really going to start to know, is this going to follow this curve upwards or not? And so we've got a little bit more time that we're not going to truly be able to tell.
Pardon me, can I interrupt you? Our live stream went down, so if we could just pause for 1 second so we can get the live stream back up.
Absolutely.
Sorry. Hang on, I'll let you know here when we're up and running.
I was talking too much anyway, so.
Our IT is working on it. I'll let you know when we're up again.
Okay. I'm not sure which part is down. I can see everybody move still.
Yeah, we have this live stream on our YouTube, so other folks in the public can watch it. So it's okay for us, but in terms of the public's viewing.
Oh, I didn't realize this was going out for broad public consumption as well.
You're famous, doctor.